Hi everyone, this is Rachel, the project coordinator for our Early Psychosis Learning Collaborative. Please feel free to introduce yourself in the chat box. And I just wanted to review a few housekeeping items with you all before we begin. Participant microphones will be muted at entry, and you'll be able to unmute them during the discussion portion. And during the presentation, if you have any technical difficulties or questions about the topic, please use the chat box. And this webinar is being recorded and will be available for viewing at a later time on the MHTTC website. And to reach us after the webinar, you can email newengland@mhttcnetwork.org. And with that, it is my pleasure to hand it over to Kelsey Johnson for introductions.
Yeah, hi everyone. It looks like we have a great group today. So I'm here to introduce Emily, who will be the speaker for this talk. So Emily is the Director of Psychological Services at Boston Medical's RAP Clinic. So she's a licensed psychologist trained in child and adolescent intervention, and her current research focuses on increasing access to high quality early psychosis treatment and in family communication in the context of emerging mental health difficulties. So we're excited to have Emily here today to use some of those discussion skills that she's been using with families in this really unique and I think really important topic right now of vaccine hesitancy. So welcome, Emily.
Thank you. Thank you for inviting me to do this. Certainly a hot topic right now. So I hope that this is helpful. I just want to say I won't be able to keep an eye on the chat and also remember what I'm supposed to be talking about. So I'm going to rely on Kelsey to keep an eye on the chat, interrupt me if there's something really important, and otherwise flag questions for the end when we'll have time for some Q&A and discussion, hopefully. So as Kelsey said, I'm a psychologist at Boston Medical Center. I'm on the faculty of psychiatry at BU, Boston University, and my area of specific expertise is in treating teens and young adults with recent onset psychosis, but I've worked with people throughout the lifespan and with different disorders, and I've really found that motivational interviewing has been one of those tools in my toolbox that I reach for probably more than anything else. It's just become kind of the way I interact with people, and even to some extent in my personal life. So I want to share some of those ideas for you all who are working with your clients and maybe wondering or nervous about having conversations with them about the COVID-19 vaccines. So I want to do a poll quickly just to get a sense of who we have here. I'm assuming most of the audience is clinicians, though there's nothing that, if you're interested in this as a friend or a parent or a human being, I think you'll be hopefully able to use all this information in those capacities as well. But for those clinicians who are in the audience, I'm curious how many of your clients you've spoken to about the COVID-19 vaccine. Okay. I'm going to close the poll in 3, 2, 1. Okay, so it looked like the audience is maybe about 65% clinicians, at least people who answered this poll. And there's a little bit of spread across these, but most of you are talking with your clients about the COVID-19 vaccine. Okay, I want to do another poll. I'm curious how many of your clients have received the COVID-19 vaccine. Great. Okay, 3, 2, one. All right, I'll share the results. So it looks like most people are in the some category. So there may be some people you know, this happens to me. I have it on kind of my mental agenda when I'm going to talk with a client or a family and I forget to bring it up. Or it may be that some people are, you know, you've brought it up and they're reluctant, or they haven't been in to see you in a while. So you haven't had a chance to talk about it with them. But most people are saying some. Okay, one more poll. You know what, I'll do that one later. So I'm going to go back to sharing my screen. And I'd like people to type in the chat, what are some of the reasons that you've heard that people haven't gotten a COVID vaccine yet? All right, so I can see the chat now. So some people want to wait and see. Some people have safety concerns. Some people are worried about interactions with other medications that they're taking. Some people have worries that it's going to alter their DNA or cause fertility problems. Some people just feel like we haven't been studying this long enough. We don't know the long-term effects of the vaccine. We don't know what's in it. We need more information. Oh, it's interesting one, a minor whose parents won't let them. Some people are facing more access barriers. So all those things were sort of more ambivalence barriers or internal barriers, like I'm not sure if I want it. There's also access barriers like transportation. Somebody brought up fear of getting sick, which is, it could be an access barrier if you can't get a day off work. You know, if you're worried that if you get it, you're going to need to take the next day off and you just can't afford to do that right now at your job. Some people have already gotten COVID and they're not sure if it is really going to benefit them to get the vaccine. Okay, so wow, a lot of reasons here. Thank you. Thank you. This is great. And then some of them seem, you know, more maybe like ideas from social media, like fear of getting microchipped. Here's a good one. We serve undocumented patients who don't want to participate in any kind of government tracking. So, you know, those are both psychological barriers, ambivalence, as well as external barriers having to do with access or, you know, fears related to the external world. Thank you. So every person has their own reasons for wanting or not wanting that vaccine. And as I said, those barriers can be internal or external, and we really have to ask and listen in order to understand what they are and how to resolve them, right? So if I'm coming at my client with all this information about, oh, we have this great free clinic downstairs, you just walk in, you don't need to make an appointment, but my client is concerned about getting tracked by the government, that is not really going to alleviate those concerns, right? I'm addressing an access concern, and what they're struggling with is, you know, do I trust this concern? So we have to listen in order to be helpful. I also want to point out that ambivalence is okay, right? Most of us are not 100% about all the decisions we make. If you think about a big decision we made recently, like I can give you one. I recently bought a used car. And I'm not going to tell you my mind was 100% made up every second of the way, right? I was nervous to buy this car. I thought, do I really need it? Is it too, am I paying too much money for it? Is it too used? It's not going to be a good deal. I had fears and I had ambivalence, and I went ahead with it because I thought the pros outweighed the cons, and that was enough for me to make a decision. And being pushed toward a certain outcome by someone who seems to know it all can actually backfire, because, you know, we have our ambivalence and we're protective of that, right? Like we want to feel like I'm smart enough to make a good decision in spite of sometimes feeling ambivalent. I don't want somebody to push me in a certain direction to make me act sometimes. I also want to address the fact that on this call, we're mostly mental health providers. I mean, that's what I am. I'm not an immunologist. I like to stay in my lane, right? Like, I don't like to talk about what mRNA does or doesn't do. That feels above my pay grade. I don't know. I don't want to be in a position of giving advice about that. And yet I also feel like I am often the most trusted and sometimes the only healthcare provider that my clients have regular contact with. And I do think of talking about other important healthcare decisions as solidly being in my lane, so decisions about, whether to exercise, how to exercise, making dietary changes, whether to, get side effects monitored when people are on antipsychotic medications. I talk about those things all the time because I might be a mental health care provider, but I'm a healthcare provider, right? And those things I do think of as being sort of my business or within my area of expertise. So, I want to put out there that COVID-19 vaccines are in this respect very much in our lane because we want our clients to be healthy. And we are trusted representatives of the healthcare establishment, whether we think of ourselves that way or not. So, okay, I'm here because you all wanted to learn about motivational interviewing. So for those of you who are not familiar with it, I'm going to call it MI because motivational interviewing is a mouthful. And it's a communication style that's widely used by health professionals to talk about making healthy changes. And there's a ton of research behind it. So I didn't invent it. It's really been around since the 1990s. And there's been lots of time and lots of studies on this showing that it works pretty well, especially compared to other strategies of persuasion or trying to get people to do things. It was developed in the area of substance use disorders with the goal of increasing people's motivation to do things that, they may feel extremely ambivalent about, like reducing their alcohol and drug use. And the basic premise of MI is that the best way to influence another person's behavior is actually by respecting their independence and creating space for them to explore their own motivation for change. So it's a conversation. Here's the basic philosophy, or at least the way that I like to understand and describe it. In order to consider making a big choice or a change, which is hard to do for all of us, people need to feel understood, not judged. People need to feel confident, like this is definitely something I can do. And they need to feel in control. It's their decision. So as this applies to how people might think about getting a COVID vaccine, I might think someone who feels really understood would say, well, my doctor gets why I wasn't in a hurry to get the vaccine at first. They understand me. They would feel confident, like now that my car is fixed, I can schedule an appointment, that those access issues are taken care of. And they would feel in control. They don't want to be pushed into the decision. They want to make that choice for themselves. So because we only have an hour together today, and it's already 12:15, I'm going to kind of dive into the deep end with you all and share a cheat sheet that I've created that I think of as a really good MI cheat sheet, 5 steps for a good conversation about a difficult topic. So I'm going to go through each of these steps with you all. Step 1 is setting the stage. So this means picking your moment, a moment where you have adequate privacy. If this is over a telehealth visit, you want to make sure you have the person's full attention and they have some privacy, that there aren't a lot of people walking through the room, that you have adequate time, that you don't bring this up in the last 30 seconds of your appointment, and that you have adequate rapport. This might not be something that you bring up right after an upsetting conversation about maybe a break in your alliance, that you're coming at this from a strong stance of trust. Take a deep breath, because you need to really be calm through this conversation in order to use your best skills. You know, this is going to require your full frontal cognitive capacity to kind of control your impulse, maybe to criticize other people's opinions, because we all have a tendency to do that. And to be really brief and direct, I want to talk to you about the COVID vaccine. The second step is to ask an open-ended question. And when you do this, it can't be a Socratic question where you're trying to prove a point. It can't be a judgmental question, and it can't be a question that has an answer that could be 1 or 2 words. You have to really be like Curious George with this butterfly here. I just love his cute little face. He's like, what is this? He just wants to learn, right? So be Curious George, put on your curious face, and ask a really good question about COVID, what you'd like to know about COVID hesitancy, or what they're thinking about the COVID vaccine. So here's some examples of closed or judgmental questions versus open or curious questions. So instead of saying, aren't you worried about getting COVID? You could ask, what do you see as the pros and cons of getting the vaccine? If somebody says something like, I don't want to get microchipped by Bill Gates, instead of saying, well, where did you read that? You could ask an open-ended question like, what would make you feel more confident that getting a shot is the right choice? Or what else is influencing your thinking? Or if they said something like, if you wanted to say something like, well, I don't know if you know this, but did you know that phase 3 trials were carried out to the highest clinical standard? It's technically a question, but it's actually an answer, right? So it's not really curious. You want to know, like, what would make you feel more confident? What kind of information do you need to see? So if you all want to practice, you don't have to overthink this. It can be really simple. Take a moment to type into the chat a question that you might use to start a conversation about the COVID vaccine. Great. I was interested to hear your thoughts about getting the vaccine. If someone seems hesitant, you could say, can you tell me more about why you don't want to get it? Would you like a COVID-19 vaccine? I think that's a nice, simple start to the conversation. How are you feeling about the vaccine? What have you been thinking about getting the vaccine? I like this one a lot. The COVID vaccine is recommended for you. What are your thoughts? I think that's just perfect. I think I'm going to steal that one, actually. These are great. These are great. Are there any barriers to you getting the vaccine? That's a great one. Thank you. Okay. The next step after asking your question, and here's a hard part about asking a question, then you stop talking. Okay, so you have to put out your question and then not talk. It's harder than it sounds because a lot of us want to fill the silence. We don't want to make people uncomfortable. We like to give people multiple choice sometimes, like, well, some people are scared of it, but some people are really excited to get it, which is you. Just ask the question and see what they say. And that gives you a chance to listen. And once you've heard what they say, you reflect it back. So you use what's called a reflection to really convey that you're listening and that you want to understand and you want to make sure that you've got it right. So here's what a reflection is. It's a statement, not a question. So your voice has to go down at the end. That's important. It's specific. It's not generic. You don't just say, oh, that must be hard. You want to really tune into what they're saying and give a specific reflection. And what you do is you repeat back what you heard the person say, or take a guess at the feelings underneath or the meaning that they might be trying to convey. And even if you don't quite get it right, what a reflection does is it helps the other person feel understood and accepted and hear their words echoed back to them. so that they have a chance to think a little more deeply about whether they really meant that, or what else comes to mind when they hear their own words reflected back. It also shows that you're not trying to control the conversation in that moment. You're putting them in the driver's seat. Here's what I'm hearing. An important thing about reflections is that they don't judge. It's totally non-evaluative. So you're not saying whether you agree or disagree with their take. And that makes some people nervous, right? Like that as a healthcare provider, we have a certain obligation to immediately correct under any misunderstanding that someone might have. And that's not what a reflection is about. You have to be willing to press pause on that impulse to correct or to say, well, for the record, this is actually what's happening, or to say that information simply isn't true. With the reflection, instead, you slow down and you might hold off on giving your own perspective for later in the conversation. You're not necessarily agreeing, but you're just not judging. And reflections that pick up on values and strengths are especially good. I'll give you an example of what I mean. So if someone said to you, well, I've heard that the side effects of the vaccine are worse than COVID-19. You might reflect that by saying, okay, so you're worried about getting sick from the vaccine itself. And you hear how that's different than if I said, you're worried about getting sick from the vaccine. It's your voice goes down. It's a total accepting stance. I'm just listening right now. You could also say, okay, so maybe catching COVID wouldn't be that bad. Again, that makes some people nervous, but what you're doing is reflecting. You're not saying you agree or disagree, and you can do that later in the conversation. Or you could say, you're still thinking through the pros and cons. Here's another example. If someone says, I don't like how they rush the studies, I'd rather wait a while longer and just see what happens. You can reflect, I'm actually hearing a value there. You could say, so having a thorough understanding of the science is really important to you, right? I'm reflecting back what's important to them, their values, their worldview. I could also say, you'd feel more comfortable waiting until others have tried it first. Or you could say, so you need to make sure it's totally safe. So hopefully I've described this well enough now that you all can practice. So if someone said to you, I've already had COVID, I don't see the point. What could you say that's a reflection? And I'm gonna pull up the chat so that I can look at people's ideas. You feel protected already. You aren't sure that the vaccine would be helpful or necessary for you. I see, you feel you already have immunity. Great. You're in a different place than people who haven't had COVID. Oh, I like that one because it's really about the individual and their specific circumstances. I'm hearing you feel the vaccine isn't relevant for you. These are all just perfect. Fantastic. That's just great. Okay, thank you all. I think those are really, really good examples. So I'm trying to close my chat, but my mouse isn't quite working. Here we go. Okay, so now I can see my screen again. Excellent. Okay. So once you've done, depending on how long you have with the person, I like to listen and just try to understand a little longer than might be comfortable or than you might be used to doing. So you might alternate questions and reflections a little bit until you feel like, okay, I have a really good sense of what's holding this person back. And there's a couple reasons for this. Number one, the more you understand, the more you can actually be helpful. But also the more time you spend making sure you understand, the more credibility you have with this person, right? I think we've all had the experience of getting advice from someone who we felt like doesn't really get us. And it's usually kind of annoying, right? On the other hand, I've definitely had the experience. There's people I go to in my life for advice when I'm not sure what to do and I'm facing a dilemma. And the people I go to for advice are the ones who I feel really get me, really understand me. So the more that this person feels like, okay, they get it, they get me, they understand my life and my values, the more credibility you have when you do make a recommendation. And if in the course of this conversation, they voice some reason that they might want to get the shot, make sure to reflect that. So, if you heard something like, well, I know it would make my parents happy if I got it, but I just don't feel ready. Definitely reflect that. Like you could say, so it would make, on the one hand, you could make your family feel more comfortable visiting with you, but you're not quite ready to commit. But you want to pick up on those reasons and echo them back to the person and see where the conversation leads. All right, now's the time when you get to say what you think. Offer advice carefully. You probably do have information or advice that could help, right? You could tell them that the CDC is tracking fertility among people who've received the vaccine, and in the 6 months or the 7 now months that it's been out there, they've detected no problems. You could say, well, some people do get sick from the vaccine, but there's not been anyone who got the chances of getting sick from COVID are much higher than the chances of getting sick from the vaccine for most people. But you want to do that carefully. So, and like I said, I don't like to be an armchair immunologist. Like I really don't know what I'm talking about with most of this stuff. So I don't really go there, but you might know more than me. And so you might be better equipped to give that level of detailed information. But you'll give the advice that you can. And the more you've listened, the better your advice will be. I like to ask permission before offering advice. I think it's very respectful and it really increases the likelihood that someone's going to be interested in hearing what you think. So you can ask, can I share some information with you about your, COVID vaccines and fertility? Or do you want advice? Or, I've gone through something similar if you'd like to hear about it. Or I have other clients who have had, similar experiences. Can I kind of describe what's gone on with them? And it's okay if they say no. The great thing about us as mental health providers is we usually see our clients pretty regularly. So if they say no and you back off, you'll have another go at it next time you see them. And the fact that you were so respectful during this conversation is going to increase your credibility and increase that rapport for the next conversation. So this is a long game, right? It's worse. Like what would you rather happen? That your client gets mad at you and storms off and maybe even stops seeing you as a mental health provider and doesn't get vaccinated? Or is it that you keep talking about getting vaccinated for a few weeks or even a few months and eventually they do, right? That's what I'd rather have happen. If it doesn't happen today, it doesn't happen today. Sometimes, and I know we've all experienced this as therapists, you have a conversation with someone in your session, they seem completely uninterested or non-committal, and then they go home and they marinate about that, what you talked about with them, and they come back in a week or in a few weeks and saying, I did that thing we were talking about. And usually they don't even give you any credit. That's okay. We don't need it. We're just happy when people get better. The last of my 5 steps is to remind them who's in charge. And of course, they're in charge, right? We're not in charge. We all want to be in control when it comes to these important personal health decisions. So don't get drawn into a power struggle or overcome by your own need for certainty by being like, okay, so you're going to do this today, right? Instead, offer your advice and then respectfully take a step back and say, so what do you think you'll do next? And see where that goes. I just have a few more kind of slides to maybe stimulate some discussion before we do a little demonstration, which is thinking about special considerations for individuals with serious mental illness. You know, it's certainly true that the sort of public discourse around vaccine mistrust may play into people's existing symptoms and exacerbate their paranoia or their somatic worries and preoccupations, like of being microchipped or, you know, having something wrong with their body or their reproductive organs or something like that. So we want to be sensitive to that people may have a really strong reaction around those things. There's also some research out there that shows that people with serious mental illness who contract COVID are at high risk for worse outcomes, and that they may be also more likely to contract it, like if they're living in a group home or, you know, I've even heard of people who've unfortunately contracted COVID while hospitalized for mental illness, which is just really tragic. So, you know, these conversations are really important because we really don't want people getting sick and seriously ill. But at the end of the day, you know, people with serious mental illness have just as much a right to make their own decisions about the vaccine as anybody else. And, you know, some of the mistrust that we come across may even have to do with past experiences of getting forced treatment that may influence their vaccine attitudes. So it may be a slower conversation that plays out, or a conversation that plays out over numerous sessions, where you really build trust over time. Also a word about family issues. So family involvement may be very helpful for logistical issues like making an appointment or getting a ride. But families also may need to kind of back off a little bit and let individuals with mental illness make their own choices. And it can be really helpful to briefly explain sort of the premise of what you're doing so that family members aren't confused. Like, why does this person seem to not care whether my child gets or my sibling gets a COVID vaccine? Isn't it their job to convince them to do it? And, you know, if you're able to, in order to avoid that confusion, you might find a way to communicate that it's important to you and you're actually using your best skills, your most sophisticated approach.
Emily, there's a question in the chat related to that and a previous point asking, is it okay to say, that's okay if you change your mind, I'm here, and then wait for the patient to tell us when they're ready? Or like, how often should you be bringing this up in later visits?
That's a really thoughtful question. You know, I think you know your clients best. I think the way I would probably phrase that, if somebody said, no, I'm really not interested, I would say something like, okay, well, I'm regularly checking in with all of my clients about this. So, you know, I'm going to have to check back in, or I'll check back in with you about this in a few weeks, but that's totally fine. You know, and you can even like blame your medical record system or company policy or something like that. Like, oh, I get this big alert every time I see your chart and, you know, about COVID. So I just want to ask you, you know, have you done any more thinking about that? Or, you know, what's your thinking this week?
And then another question about any suggestions for people who have needle phobias.
That's such a great issue. Yeah, because I always feel like there's actually a lot of those people out there, and they may be embarrassed to admit it, or that that's actually more of a barrier than we probably think about it. I think about that with pill swallowing difficulties too, for medication adherence, that people who are otherwise ambivalent, you know, but leaning towards getting a vaccine or taking their medication, that difficulty with pill swallowing or needles may tip the scales in the other direction. And that's just kind of really unfortunate. So I think that's a great question to ask also, like to ask in a really non-judgmental way, like, how are you with needles? To get a sense of whether that might be at play. And then, you know, there's really good needle phobia desensitization techniques. And actually that's where you can use your really good skills as a mental health provider to specifically address that phobia, right? Through teaching some relaxation exercises and, maybe doing some exposure in your sessions, like let's look at a picture of a needle together, and you can try and do some deep breathing until looking at it doesn't give you a reaction anymore, and kind of build up to that appointment, because those kind of graduated exposure exercises are very effective. A few other considerations to be mindful of is that for those of us who work more with teens and young adults, they are lagging the older population, but in some ways they're a more approachable population because, pretty much everyone in New England who's like over 40 or over 50 has been eligible for a while. So we can assume that if they haven't gotten it, they may not want it, or there may be something really getting in the way. Whereas younger people only became eligible more recently. So we can, just go at it sort of without any assumption about if they haven't gotten vaccinated. It could be because they don't know they're eligible. It could be because they don't feel they need it. Or it could be just because they haven't gotten a chance yet. Maybe the CVS in their town has been really booked. Younger people also, may be spending a lot of time on YouTube, and there's a lot of vaccine misinformation out there, specifically relevant to younger people, especially all of the fertility concern misinformation that's been circulating. And then, we're a New England audience mostly here. So compared to other areas, of course, we have very high overall acceptance and availability of vaccines. Kelsey was just saying to me before this webinar that the rate in Massachusetts, the rate of people who really are sure they don't want it is in the single digits, which is awesome. But people may be ambivalent or not have had a chance or have access barriers. And even though we have relatively widespread interest in the vaccine, not a ton of people saying absolutely not, there's still a lot of people who haven't gotten it yet. And we do see these big disparities between racial and ethnic groups. So this is a slide I made as of 5/24, so a couple weeks ago, but it shows that Black and Hispanic residents in Massachusetts anyway are significantly lagging white and Asian residents in terms of getting their vaccines. So there may be culturally specific reasons that people are fearful or reluctant, or there may be a lot of access issues, or a combination of both. These things can intersect. Like if I have an intention to go exercise today and the weather is beautiful, I'll just put on my shoes and go for a walk. But if I have an intention to exercise today and the weather is terrible, then I have to go down to my basement, and I'll tell you there's about like 6 boxes for some reason sitting on top of the treadmill down there. And I'm like, I don't feel like moving those boxes or even looking at that mess today. So that's where access interferes with my ambivalence. And I'll just say, you know what, forget it. I don't really care anyway. But just to clarify, everyone age 12 plus is now eligible to get a vaccine. You don't need to say or have a comorbidity in order to schedule an appointment. And Kelsey's going to give a lot more information about the different resources that are available to people who do want to make those appointments. So just remember, in order to consider a healthy choice or a change, people need to feel understood, confident, and in control. If you're coming up against, if you find yourself arguing with somebody, you're having sort of a breach of rapport, I find it really helpful to use this as a framework to say which of these 3 things has broken down and how can I repair that, and kind of keep those 3 factors in mind. So with that said, I'm going to, I think, maybe keep this slide up, but also invite my colleague, Dr. Sean Davis, to unmute himself, and maybe one of the hosts could pin his video so everybody can see him.
Perfect. Thank you.
Great. So can people see both of us now? Great. Thank you, Kelsey. All right. So we're going to do kind of a demonstration. When we do demonstrations, we like to keep it a little bit real because it just makes it, I think, more richer and more interesting. So Sean, you're going to be my therapist today and talk to me about, I've already gotten my vaccine, but and my kids aren't eligible yet, but I don't know, whether I really want to sign them up to be the first ones to get vaccinated when they are eligible. So Sean, how do you want to, so we're going to do the bad version first, right?
Yeah.
Okay.
All right. So Emily, I just wanted to take a moment and talk to you about vaccinating your children. They meet the eligibility requirements now. So I'm wondering if you've thought about this.
Yeah, I mean, they're both due for flu shots today. So I don't want to like put them through too much, make them like, I think eventually I do want to get them vaccinated, but I don't think today's the day.
I wonder if you've considered that, getting all the shots done at once would be really helpful for them, that you wouldn't have to come back in. They wouldn't even know the difference. It seems like this might be a really great opportunity.
Yeah, I mean, we could, but I live just down the street. It's so easy for me to bring them in. I mean, we're here all the time anyway. They constantly have runny noses. I don't see any rush. Yeah.
I'm sensing some resistance here. What are your concerns with the vaccine?
I just, I mean, I feel bad for them. Like they're both due for boosters and they have flu shots today. And I don't know. I mean, I do want to get them vaccinated, so I guess we could do it. Yeah, I don't know. I mean, I think it's good for them to get vaccinated. I want their lives to be normal.
Yeah, and the best way to do that is for them to be vaccinated, right? You don't want them to get sick. I have this really great vaccine pamphlet I can give you that shows, the benefits of getting the vaccine. So it seems like this will be a really good choice for you.
I mean, I know the benefits. I follow the science pretty carefully. I'm a researcher myself, so I mean, I know, I get it.
Yeah. Well, if you know it's the right choice. It seems like it'll be really great for you to get them the vaccine.
All right. So, I think Sean is like so nice. I can't feel judged by him no matter what. But he came on a little strong there. Maybe was a little pushy. I don't think that was egregious, though. I have to be honest.
It's like, here's this pamphlet.
Yeah, here's the pamphlet. I'm like, I know the research. I've been as obsessed with COVID as anybody else. So let's do that over again. In some ways, I didn't like being pushed. I found myself pushing back a little bit, like just to be like, well, I live right down the street. I can decide when it's right for me.
Right. Yeah.
So
I'm wondering if people can hear us. It keeps popping up in the chat that someone can't hear anything. So can other people hear us, or is it just one person? Okay. All right. Just wanted to make sure, just in case.
All right. So should we do that over again?
Sure. Yeah. Okay. All right. So, hey, Emily, I just wanted to take a chance to talk to you about, the guidelines for vaccination. It seems like your kids might be eligible now. What do you think about that? Oh,
yeah. I know that they're eligible because I follow the news on this really closely. I do want to get them vaccinated. I don't know that today's the day.
Mm-hmm. Well, it seems like you've been staying pretty informed about the vaccine and their eligibility.
Yeah, their lives were so disrupted by COVID. I really want them to have like a normal school year this year. And, when the weather gets cold again, I don't want to have to kind of go into isolation mode like we did last winter. So I've definitely been following the news really carefully of when they would be eligible.
Yeah. So I'm wondering with this desire for things to return to normal, I'm wondering what's stopping you from getting them the vaccine.
I know they're due for other shots today. So I just, I don't know how many we want to give them at once. Like, are they going to get too sick tomorrow?
So you really don't want to like overwhelm them with shots.
Right, exactly. I feel, especially my daughter, she tends to like get really fussy and feverish. Sometimes, not always, but with a couple shots she has. So I just, um, I'm not sure, especially because I really can't take tomorrow off.
Hmm.
I have a lot of meetings that I can't reschedule. So I don't know, maybe if we could do it like on a Friday.
Yeah, it sounds like you've come up with a pretty good plan. What do you think you'll do?
Well, can I schedule with you to do it on a Friday? Or should I go to the front desk?
I think the front desk might be a little more equipped to handle that, but yeah, if you do that during your checkout, I think they'll be able to help you.
Okay. All right. Thanks. That sounds good. All right. So, what did people notice about that? Oh, people had some good ideas of, questions to ask. Yeah. So Maria is noticing he was really not pushy. He validated my concerns. He didn't make me feel like I was neglecting. It's so true. Like, he didn't make me feel like I was a bad parent. Like, he really showed respect for my concerns, whether he agreed with them or not. Yeah, I also liked it. Becky West said he affirmed me and what I knew. Like, he treated me with a lot of respect when I said I've been following the news carefully. I felt like, okay, he reflected that back to me. I felt like, okay, he gets me as a person. Great. Well, thank you. This is great. Yeah, I didn't feel at all shamed. I just felt like he was very respectful. Okay. So we don't have too much time left. I want to, there's so many great resources out there supplemental to this webinar that I want to give Kelsey a moment to review those. And then we may have a couple minutes for questions. I'm not sure. Thank you, Sean. So Kelsey, should I stop sharing my screen?
Sure. Yeah. Sorry, I was just getting the spotlight up. Let me pull up on my screen. And I apologize to people outside of New England. The materials that we really put together with MathNet are very Massachusetts focused. And I think that as far as the logistics goes for helping people find vaccines, having materials that are as regionally focused as possible is really helpful for people. But that said, I know there are a lot of good national resources. So just to put that out there. So I'll share kind of what we've put together. Here we go. Yeah, let me know, Emily, if that's not showing up. But this is a page on our website specifically since we work with people with early psychosis. But the biggest thing here is this Q&A from EpiNet. So I don't know if people are familiar with EpiNet, but it's a national organization working with early psychosis. And they put together this fact sheet for helping people decide whether to get the vaccine. And it really pulls from some of the motivational interviewing skills, really pushing at the beginning, what are the benefits and what are things that would motivate people before addressing some common myths. Although I know this was published a little bit ago, but really all the information in it does hold up. And these were concerns that were brought up specifically from people or in our early psychosis community. So really directly relevant. So other things that we have on here, information about eligibility. And again, this is Massachusetts specific, but is applicable for the US, everyone ages 12 and up. And here they make it very explicit that you don't need an ID or insurance or to present any of that information, which I know there was a discussion in the chat a little bit earlier about undocumented populations, and that's been really important with that group. So some resources for how to get an appointment. I think this is a really good time for us to be having this vaccine talk because there are walk-in appointments now. So I'm sure these conversations were a little bit harder when there was a lot of more upfront work that people had to be doing. But at least here in Massachusetts, you can get a Lyft ride to a vaccine. You can get a ride through Mass Health. You can schedule an in-home visit, which is really available to everyone, regardless of if you have a documented health issue or not. So really, I think the state is prioritizing a lot of different options to help people access vaccines where they are in a way that is available to them. So all of that information is on here. And then again, some of this information about how to help with transportation. So all of this is on our MapNet website. And then you also had brought up the SMI advisor page. Oh, this is our, Boston is doing a vaccine town hall this week. But SMI advisor has published a fact sheet that is pretty similar to everything that Emily has been talking about today. So really just want to promote this, and I can throw the link in the chat after I'm done talking. But they have a guide here that really goes through the same talks that the same steps that Emily had talked about. So making sure you understand what people's risk factors are, making sure to ask, elicit information, really listen to it. But they have some guided steps in here that fall under this motivational interviewing framework. And then I guess the last thing, I'll stop sharing my slides, that I'll really bring up is that on Friday, MHTPC is leading another webinar specific for patients and families. So this is a space where patients and families can really ask questions of some of our vaccine experts in Massachusetts, and we'll also have some peer specialists, again, with our early psychosis population, who can talk about their experiences getting the vaccine and answer any questions specifically on the mental illness front. So I can stop there, but yeah, I'll put some of these links in the chat since I've seen a few requests.
Great. I just want to address, one question that seems to be coming up in the chat, which is, a lot of people just say, no, I don't want to talk about it. And where do you go from there? It can be a little obnoxious, right, to keep saying, well, why don't you want to talk about it? Why don't you want to talk about it? So it's good to be respectful of a no and take it as a no. On the other hand, one strategy that I might try, and you could try it if you think it would work for you, is to just name, that sometimes, you could even use yourself as an example. Like I might say, sometimes I've had encounters with doctors who are really pushy, or who really judge me based on not wanting to take a certain medication or get a certain procedure. So I totally understand why you might not want to talk about it with me, but I promise I won't do that. And just name that dynamic. And it could help, it could not. Another question, how would you address people who've seen others who've had contracted COVID but had a mild case, and they therefore think it's not a very serious illness? Yeah, I think, there's this dynamic, right, where when you start arguing with somebody, they defend their position. So I think just use that same, reflection skill, which is to say, so people, who've had COVID, have not really suffered from it. So you're not very worried, and see what they say. And, if you're not getting anything on the side of getting vaccinated, you can ask, do you see any benefit at all to getting this vaccine? And then if they say no, really to kind of even amplify their position and say, okay, so to you, this is just, it's completely irrelevant and you've made up your mind. And, sometimes that actually, when you really affirm someone's control and understand their perspective, sometimes they do come along with you and they say, well, I haven't completely made up my mind. Or you might just leave it there. This is all about kind of putting your agenda aside for a couple minutes and trying to trust this process to lead you somewhere productive. Because what you already know is saying, well, other people do get COVID, it can be very serious. And I know people have been hospitalized. Hasn't worked, right? For a lot, I'm sure a lot of people have tried that and it hasn't worked. So this is just about trying something different and trying to trust in the process and to say, well, there's a lot of research showing this works, so I'm going to try it, as opposed to kind of doing the thing that isn't working, but that we feel pulled to do. Wow, such a great question. Are there resources to discuss the vaccine and virus with individuals who have intellectual and developmental disabilities or who may be blind or visually impaired? I don't know. I'll kick that back to you, Kelsey. I don't know the answer.
Yeah, I haven't seen things that are specific, but I would imagine, those types of things tend to be state specific. I'm sure Massachusetts, like homebound program, and those sorts of things are aimed to make things more accessible, but it would probably depend on someone's location.
Mm-hmm. All right, well, thank you so much for having me. Any final housekeeping from the hosts?
Thank you all for attending today's webinar, and you'll be receiving an evaluation form right afterwards.
Great. Take care. Good luck.